All right, part one. Welcome back. This is part one of our talk on diet, exercise, and supplements for cardiovascular longevity. Okay? So I really am going to go over a lot of stuff, but it's going to be concise. And if you want to know more, vailvalleypharmacy.com. And today, the first one is going to be diet. And how come diet is so important for longevity and cardiovascular health. So tune in. Thank you. Welcome. Welcome back, guys. Dr. Kent here, and this is part one of a three-part series on cardiovascular health. All right? If you just do what we're going to talk about over these next three segments, it's going to give you your best opportunity, better, and I'll show you better than any pharmacological presence that you can take. There's no blood pressure pills, cholesterol pills, or any of this that has better clinical outcomes than diet, exercise, just changing your lifestyle, and then taking some supplements to help out. All right? This is kind of a crazy point. So 75% of clinical outcomes with cardiovascular events, according to the CDC, are because of poor lifestyle and environmental toxins, so inflammatory stuff. Yet, greater than 75% of patients that go in for certain types of cardiovascular problems get prescription drugs. So even though the CDC is telling us as healthcare providers that, hold on a second, it's lifestyle, okay? We're still just here, here's a pill. Get out of here, keep eating whatever you're eating, okay? So what I really want to show you over the last 40 years, and I talked about this last week, our diet has just fallen so far down the wrong pathway, it's killing us. Okay, it's not cholesterol that I'll show you later. It's not cholesterol. It's inflammation due to our diets. It's inactivity. Okay? So what I want you to do is take a look at this slide, and this slide is going to show y'all the last 30, 40 years. Super interesting. This slide show you can see is over the last 30 years, you can see how obesity has grown. And then overlap it on this next slide and show how also in parts of the United States, this is kind of interesting geographically speaking, inactivity, diabetes, and obesity, if you put those maps right on top of each other, guys, look at that. And where do you think the highest risk of cardiovascular events are? Okay? So what we need to think about when you look at stuff like that is that's lifestyle. That's not cholesterol. People aren't having heart attacks because of cholesterol. They're having heart attacks because of inactivity, lack of exercise, doing the right stuff every day, and diet. Okay? Our blood sugar levels are going up faster than any other nation. And that the inflammation that blood sugar causes it's wreaking havoc in our bodies. Okay? Our bodies are unbelievably resilient. So our cells can handle fluctuations of toxins and fluctuations. I remember my detox when I said, hey, you know what, we're pretty darn resilient on our own. Don't spend $500 on a detox. We're resilient. Okay, our bodies can bounce back. However, there are cumulative effects from our daily lives at the cellular level that grow and over time put you at risk for disease. You know? Just like reversing this process takes time. I mean, you are getting cardiovascular disease if you're not a genetic variant, you don't have a genetic SNP or something. You're getting cardiovascular disease over your lifetime, right? Well, you're also healing your body over a lifetime and starting to do stuff right. And you're going to start to do stuff right now because 30 years from now you want to be here and still be running around your body. So let's follow some simple steps over these diets that I'm going to be talking about to prevent cardiovascular disease in your life, give you your best opportunity. So the really interesting thing is, I'm going to show you this slide, and I know there's going to be a bunch of slides here, but I'm going to show you this slide. Take a look at this. That slide, you can see patients with diabetes and low cholesterol had a higher risk than those without diabetes and high cholesterol. So what is this showing you? You see these people on the far end, they could have a cholesterol of 400. They're not dying of heart attacks. But look how high your risk is if you have blood sugar issues, insulin sensitivity. I'm telling you, we have got to get blood sugar under control. We got to keep inflammatory processes low on a daily basis to let our cells get this resilience necessary to handle, the aging process. That's what we got to do. So I'm going to throw a slide up this time and just show you the difference and how your body, how your liver metabolizes. Cholesterol is important, don't get me wrong. You want good cholesterol. You don't want to be dyslipidemic. You want high HDL, your good cholesterol, to clear out your arteries. You want low levels of VLDL, which is your bad cholesterol, your low density level. You don't want a lot of low density sticky cholesterol. But I just show you how our diet in the United States has affected the way our liver produces cholesterol. Take a look at this slide. See, with a healthy diet, our liver produces the cholesterol necessary for the day, and you end up with very, very few very low density lipoproteins that are sticky and atherogenic. Now, the United States diet is so full of soda and processed foods, unhealthy foods, our liver actually produces a different style of cholesterol. It's pretty simple. It's bad. We know this. So if we eat right, healthy foods, and I'm going to give you some choices here in a minute, your body works better. It works less hard to produce good cholesterol. It works harder to produce bad cholesterol, so in the end, you're using more energy to kill yourself. Okay? So what I'm going to do is I'm going to go over, I also want to show you one more slide about blood sugar, okay? And how insulin resistance can impact how long blood sugar stays in your blood. So take a look at this last slide. If you look at a low glycemic index food, which we'll talk about later, and how quick your blood sugar goes up but not overly high, and then a few minutes later your pancreas spits out insulin, grabs the glucose and brings it down. Within 3 hours you're back to a normal level. Look at high glycemic index foods. So fast foods, foods with lots of processed and breads that aren't even bread anymore. Look how high your blood sugar goes. That's what high glycemic means. Your body, your pancreas has to shoot up that much insulin to get your blood sugar under control. But by the time it comes back down to the normal range, your insulin shoots it down underneath, so you become hypo. Now, you're freaking hungry for an ice cream sandwich later, okay? So, low glycemic index foods, green leafy vegetables, fruits and vegetables, raw vegetables, a lean protein. That's what your body's supposed to do. That's how your body is supposed to process foods and get it back normal. You're using so much extra, and over time, your pancreas wears out. You can see how pancreatic beta cells that take care of blood sugar blow up so big because they can't keep up, and over time they burst, and that's how we become insulin resistant. Your muscles just can't even hold the sugar and put it back in the muscles fast enough, and your pancreas can't keep up, and eventually you diabetic, which I think is the leading cause of cardiovascular disease. It's the blood sugar issues, okay?